Got it? Yes. Okay. Okay, good morning, afternoon, evening, wherever you may be. Thank you all for joining some in person and then online. We really appreciate this. This is a health systems series seminar, and Center for Humanitarian Health is sponsoring this, and we're really thrilled to be able to have Dr. Hugo Slim join us for this particular both the series itself, but also the topic, which is obviously on everyone's mind and is hugely important. And so we're thrilled to have you all. What we're planning to do is to have Hugo speak for 20 minutes. It's going to be a very unique experience for public health people because he's not going to have slides. So that means you actually have to look at him. But he's going to speak for 20 minutes, and then we're going to invite Mariah Merritt and Gabrielle Prager to the table together with Hugo, and they'll be discussants. So Mariah and Gabby will provide some of their thoughts on Hugo's new book, of which I'll introduce shortly, and then we will open it up for questions and comments. So it's really a pleasure to have Hugo. Even before we had met, I'd been reading about Hugo and his work, and particularly in the humanitarian world, the humanitarian principles, international humanitarian law and ethics. And he's really always pushed the boundaries and really made us think. And so it's no surprise now that he has a new book out looking at climate change and humanitarianism, and he will talk about that, so I won't go into detail. I'll just briefly read his bio, and then we shall be off. But I did get to meet Hugo a couple of years back when I just started actually at Hopkins, and some of the students may be aware of the Mosul, and we did a Mosul case study, and there were a lot of questions about the response to Mosul with WHO and the health response, and then ICRC and MSF had various concerns of putting people on the front line and embedding them with military forces. And so that was my first time meeting Hugo, and it was a pleasure to, at that time he was with ICRC, the International Committee for Red Cross, and it's been a pleasure to be able to work with him ever since. So Hugo is a senior research fellow at Las Casas Institute for Social Justice at Blackfriars Hall at the University of Oxford, as well as the Institute of Ethics, Law and Armed Conflict at Oxford's Blavatnik School of Government. He's also a visiting professor at ICRC, the International Red Cross, as well as it's the International Red Cross and Red Crescent Academy at Suzhou University and Schwarzman College in Tsinghua University in China. His career really is combined academia, policy making, humanitarian diplomacy, and frontline operations. And that's another reason why I really admire Hugo, because he has really done the gambit from academia to being on the front line, and there aren't that many people that are able to do that. So Hugo's worked when he first started, he worked for Save the Children in the field for a long time, and then the United Nations, Oxfam, Great Britain, the Center for Humanitarian Dialogue, and the Catholic Agency for Overseas Development, CAFOD. And in 2015 to 2020, he was the head of the policy and humanitarian diplomacy at the International Committee of the Red Cross. He has numerous books, but his current book that we'll be talking about today, that is really hot off the press, is Humanitarianism 2.0, New Ethics for the Climate Change Emergency. And many of his other books really you can see the progression leading up to something like this. So we're really thrilled to have Hugo here. He's also, as a plug, we have CHH's, the Center for Humanitarian Health, is chairing a Lancet Commission called the CHH Lancet Commission on Health, Conflict, and Forced Displacement. It'll be a 2-year project, and Hugo's also a commissioner, helping us both in terms of the international humanitarian law and humanitarian principle component, as well as the climate change working group. So Hugo, thank you so very much.
Well, thank you very much, and thank you for inviting me to Johns Hopkins. It's a real pleasure. And thank you for being Johns Hopkins, all of you, because you are, one of those extraordinary institutions in the world which genuinely does have a global impact. And, you change lives, you change the way we see the world, you change information we have about the world. And so it's a great pleasure to be here, and especially to think of the humanitarian work that's going on here under your leadership, Paul, and how important that is. And that too has become globally significant and is pushing new thought, new facts, and new analysis, which is great. So it's lovely to be here, and I'm going to try and think about what I'm calling humanitarianism 2.0, which is what I think we need. A change in our values, a change in our sense of purpose as we face the climate emergency. And I suppose what my book is really saying is that the last time we really looked hard at our basic fundamental ethics as the humanitarian world of emergency aid agencies was really back in 1965, when we agreed a new set of these Red Cross fundamental principles in Vienna, the principle of humanity, impartiality, neutrality, independence, etc. Those have had a very successful life in the last 50, 60, 70 years, and have been taken up by NGOs, have been taken up by UN agencies, and have been taken up by government as the definition of humanitarian aid, humanitarian actions, and humanitarian purpose in our world. And I'm saying we've got to change them again. And I think pretty soon I'll no longer get a visa to Geneva, actually. I have a feeling that I'll have to stay in England. But I do think it's important that we look at them and we change them. It's totally normal in ethics to evolve our ethics when we see changes in the world around us. If we didn't evolve our ethics, we would not have abolished slavery, child sacrifice, the discrimination against women, and all sorts of other things that we now see clearly as vital moral values and moral purpose. So I don't think these things are carved in stone, and they're very important to a lot of humanitarians because we've been indoctrinated in them, but I think we need to change them. And why? So just to think about the challenge, I've spent the last 30, 40 years of my life working on war as a challenge, and it remains a terrible challenge to human society. But we have a new one now, which is a truly universal challenge of climate change. And although we talk about climate change and climate emergency, the change in that climate getting increasingly hotter and changing the very nature of the earth as we as humans have lived in it for thousands of years is really significant. And it's not really a climate emergency, it is an earth emergency, because that change in the climate is creating an emergency for the whole earth, for humanity and nature, and for nature and humanity's ability to go on living as we've lived for thousands of years in a certain parameter of livable earth. The other thing about this emergency is that we know it's universal, we know it's going to be long. So it's not that we're being opportunistic in changing our ethics for an immediate problem, we're changing it for a long-term problem. So I think we need new ethics. And the other thing that's happened is that humanitarian ethics doesn't live in a bubble. Global ethics have been changing, and they've been changing largely under the influence of environmental ethics, a new ecological consciousness, a new realization that we need to take our neighbors in the earth community more seriously, and the earth itself more seriously. So that's why I think we need to change and look hard at humanitarian ethics for this century ahead of us. And the challenge is, how do we find a life-saving synergy between humanity and nature? Not just how do we save human lives. So I'm going to suggest in the next few minutes that to do that, we need to recognize a new doctrine of humanity. We need to redefine what it means to be human. We need a new sense of impartiality, which is the second humanitarian principle, what fairness means and which needs are most important in an emergency. So we need to look at impartiality and prioritization. And then I'm going to suggest some new ways to work to make that happen. And I'm also going to argue that we're going to need new organizations to make that happen, because we are operating with a set of institutions and organizations and mandates that were designed largely in the middle of the last century to think about the scourge of war and the making of peace. So the first thing I'm going to think about is humanity. So the first principle of humanitarianism and ethics is the principle of humanity, that the purpose of any humanitarian here or in the front line of the Congo now or in New York at the UN is to alleviate human suffering wherever it may be found, and to protect life and health and ensure respect for the human being. And of course, that is wonderful. And that's the purpose I've lived my professional life to. And it's a really important one. But it doesn't make much sense anymore, is what I'm going to argue. The great achievement of the last thousands, hundreds of years, and particularly the last 200 years or so in our human species, is to achieve an ethical consciousness where we recognize this thing called humanity, where we recognize that we have a single moral community as a species, as humans, where we find equal value with one another, and this thing we call common humanity. And we therefore recognize we should show humanity to one another. That's been the great ethical achievement. And sitting here now, you may think it was always there and easy, but it really wasn't. And that has been the struggle. But the price we've paid for identifying this wonderful humanity across the world, across the planet, is that we have slightly over-focused on ourselves. And we have run the risk of making ourselves a sort of super species which sits and floats above the earth somehow. But we don't. So in this new doctrine of humanity, I think we need to really understand that we are earthlings. We are creatures of the earth. And that's in the very word human, which comes from the Latin earth. Humus is earth. We are earth people. We are part of an earth community. And the other thing we know, and that every humanitarian knows, is that there is no human life without other life. Always we live as hybrid, or in the jargon of today's discourse, we live as more than human lives. So we are water humans, we are rice humans, we are wheat humans, we're sea humans, mountain humans, air humans. And this morning I'm a bit of a crab human because I had my first Baltimore crab cake last night, which was fantastic. So I live now partly crab, and I'm, living hybrid identity all the time in existence. We're part of the earth community, totally dependent on the earth community. So this, in a sense, is the doctrine of mutualism, that we can't talk about humanity as if it is a single thing floating free. We have to recognize our mutualism with other species and with the earth. And that requires us to make a new doctrine of humanity that has much more of an all-life ethic in our purpose. And humanitarians know this because none of us can go and be a humanitarian. We're always trying to save human life by plugging it in to other life, food security, water sources, health, plants and products that keep us well, all sorts of things. Humanitarian work is always about plugging humans into nature in a better way somehow and bringing them together. So in the Earth emergency, survival is always a joint project between humanity and nature. And we can talk of a mutual aid. And mutual aid is a lovely phrase that came bursting back in the COVID emergency when people mutually helped each other in their street, in their community, whatever. But actually, we can talk about mutual aid very profoundly as essential to the way that humans help nature and nature helps humans, and how we must show humanity to nature, and then it can enable our humanity. So this is the kind of thing I'm arguing in the book, and it means that we need a revised principle of humanity, which talks about alleviating humanitarian suffering wherever it may be found, in harmony with nature. Or it talks about protecting the vital mutualism between humanity and nature. And it requires us, therefore, to work much more in and with ecosystems and not just on the human body all the time. So my first revision is to sort of ask and call for an ecological humanity that is fit for the Earth emergency we now face. And of course, your community in public health knows this much better than me. I mean, I'm very late to all this, and most, clever civilizations in Asia and Latin America had never forgotten this truth, that we are Earthlings in a way. But your doctrine of planetary health and One Health is really the way your sector is responding. And I think you must lead the humanitarian sector in that direction as well. So the second thing we have to do is revise the second humanitarian principle as well. We have to grab impartiality and shake that up a bit too. And impartiality, of course, is the second principle, whereas if humanitarians agree they're going to save human life, they then agree they will do it fairly. So they will not discriminate politically, racially, culturally, religiously in whose life they prioritize. They will prioritize only on the basis of need, human need in that case. So we need to change that, and we need to extend impartiality in three dimensions, really, or two main dimensions. The first is we have to shift ideas of fairness and non-discrimination beyond the human to nature. If the new definition of humanity is right, we need to address nature's needs as well. We need to keep nature alive with us in this joint project of survival. So that means extending impartiality to take account of nature's needs. So when we say responding to the most urgent cases of distress and working on the basis of need alone, we have to look at who has the greatest needs between nature and humans, and where, in which ecosystem and in which ecological area need is greatest to ensure life for humans and nature. So that's a big new challenge, but we're doing it all the time, but we're doing it in very siloed ways. We then also have to extend impartiality beyond the present to the future. So we need to have a temporal extension as well as a sort of species extension of impartiality. Because as health professionals always know, we have to think about future life as well. And particularly when we know ethically and know consciously that this is going to be an emergency that goes on and on and on. So what we do today and what we don't do today affects lives in the future, lives of nature and lives of humans. So we have to put the emergency of the future as part of the emergency of the present when we work as humanitarians as well. So we have to extend impartiality across time and across species as well. And in a way, this asks us to look at the three I's of ecological justice, if you know those, which is ecological justice says to be just, we have to look intra-generationally at the needs of this generation of nature and humans. We have to look intergenerationally at needs that are going to arise in the future, which we can impact now by what we do now. And we have to look at interspecies aid. So we have to look across the various forms of life in the world. And again, we do this already, and you medics do this all the time. But it's very important that we own this new sense of impartiality explicitly, I think, in a revision of our doctrine as humanitarians. So humanitarians do this in disaster risk reduction all the time. We are putting money and investment into adapted environments, investing in protecting water sources and things, not for people who are alive now, but for people who will be alive, and for other life and biodiversity that will be alive. You're doing it all the time. Every time you're doing vaccination, in a sense, you're thinking about the future of this life in front of you, and you're thinking about the future of other lives that will be born and don't want to have this disease around them. You're thinking about it every time you build a hospital, because you're investing a lot of money now that you could have spent on people's needs in Baltimore already today, but you're trying to invest in the health of people who are not yet born, but who will use the hospital in 20 years' time. So we work like this anyway as humanitarians, as medics, and I think we need to own it more explicitly in our fundamental principles. So this means two big shifts in humanitarianism as it currently stands. It means we are recognizing nature and other life, and we are recognizing its needs, but we're also recognizing that we need to cooperate with it as a partner in humanitarian action, that nature has humanitarian agency as well, and we need to work with that. And the second thing is, it means we are owning the fact that we do invest now for future life, which we do. So at this point, I can hear, you're medics, so you're a bit more sophisticated, but I can hear humanitarians going, this is crazy, it's far too much, you're just expanding our whole sense of ambition. We can't even save people in Gaza today. How are we going to do everything you're asking us to do? And we have massive budget cuts now. The Germans cut their humanitarian budget 50% a couple of weeks ago. So how can we do any of this? And I would agree with that. Yes, those are huge challenges. But I would say, first of all, that most places are not Gaza. So it's the old story of it's never usually wise to use the worst case as the representative case of everywhere. And there are many communities around Africa, Asia, Latin America, London, places are going to be all affected by climate change, where we're looking at the chance to do more nature-balanced, nature-positive humanitarian work. And the second thing I would say is a sort of meltdown in the system is a good time, like molten wax, to have a malleable moment in which to remold and remake the system. So I would say, in fact, this is the absolute best time to be brave about system reform in the humanitarian sector. It's a chance to remake the sector because it is becoming a bit liquefied and softer as it sort of collapses a bit and melts. So 3 practical things just to end that I'm therefore recommending that we do. And the first one is that I'm encouraging humanitarians to change their unit of analysis from the sort of sanctity of the human person, which has been so strong in Western ethics over the last hundreds of years, and move to a landscape approach. And I'm suggesting that humanitarians don't work with people in need, PINs, as their core unit of analysis, but change the P for places in need. And they begin to take a look at landscape, keeping the human very much in the center of the landscape, but recognizing the human will not exist without the landscape. And therefore take a landscape approach to a definition of needs assessment, program response, etc. And that is in order to get this kind of mutualist planning, mutualist assessment, which is much more in line with how we actually live in hybrid relations with nature. And the second thing I'm therefore suggesting is that we also change our organizations, and we work to have much more integrated organizations that have new mandates that insist that they work in combined ways on nature and humanity together. And we don't have all these siloed parallel programming going on between human organizations on children, on human food, on health, on migration, whatever, and then all these conservation nature organizations. The time is now right to bring those together and to have important organizations working with combined nature and human mandates. And therefore, integrating organizations with ecological and humanitarian expertise and response capability. And again, I think that's quite good for the current moment because it'll be cheaper if people can be brave enough to do it, because you will be cutting a lot of duplicated costs in big, expensive humanitarian and development bureaucracies and focusing much more clearly on this combined approach. The third challenge I think we have, which conceptually I find the most interesting actually, because it's always hard to change organizations, but this is how you represent nature. And if we're saying that nature is incredibly important and we need to work with it as a partner and we need to recognize its needs and bring it before it, then we have to find ways of bringing nature to the table in humanitarian policy making and programming. We have to have nature at the table so that water and water ecosystems are speaking, so that forests are saying, so that food systems and those things are able to be at the table and talk about their needs in a way. Now, this, of course, is quite surreal to a sort of Western mind. It's not particularly surreal to other minds. But I think it's a very exciting thing to do. And there are ways already to represent nature at the table. You know, New Zealand has the famous river, which it is delegated that a group of people represent the face of the river to Parliament and to other things. I think there's a lot we can do with that. And naturally, I think a lot of societies in which humanitarians end up working would understand that instantly and be able to talk about it in some way and represent nature. The other way to do it, which the Ecuadorian constitution has taken up and various others, is to talk about the rights of nature. And so you actually write in the rights of ecosystems and nature and rivers and forests into the constitution of a country, so that you are always bound legally to think of them as part of your polity and the politics. And this is the big challenge of moving from anthropocentric era to what others are calling an ecocene, not an anthropocene, where we try and think ecologically about politics for all of us. And, you know, finally, humans try and find a way of bringing nature into politics and making peace with it and working sustainably with it. So that's my basic arguments, and thanks for listening to them. It'll be interesting to hear your reactions. And just to summarize, I'm suggesting that for the Earth emergency, we must be more morally realistic and have a new doctrine of humanity. We don't float above the Earth. We're only going to save ourselves if we do it with nature. Therefore, we need to revise our two fundamental principles of humanity and impartiality. And we need to work in new ways with a landscape approach, with new integrated organizations, and finding ways for nature to be represented in that new work. Thank you very much. Govern.
Okay, thank you. Excuse me. Thank you very much, Hugo. A lot to think about, a lot to try to operationalize. So it's with great pleasure that I introduce two colleagues, Professor Mariah Merritt and also PhD candidate Dr. Gabrielle Prager. So Mariah is a professor here in the Health Systems Program in the Department of International Health at Bloomberg, and she's also a member of the Johns Hopkins Berman Institute of Bioethics. And Dr. Merritt's a philosopher working in public health ethics, and her current research deals with justice and transition to greener, more climate resilient health systems. And Dr. Gabi Prager is an emergency physician from the UK and a PhD student in health systems in the Department of International Health. She also works with me as a PhD student, and her PhD will focus on the intersections across climate change, forced displacement, conflict, and health. So we're really excited to have both of them here, and then they're going to talk and respond a little bit to what Hugo mentioned. Then we'll give it to Hugo to discuss, and then we'll open it up for questions. So please, people in the room, we'll have a microphone, and then online, please add them to the Q&A. So Mariah, over to you. Thank you.
Thank you, Paul. Thank you, Dr. Slim. So first of all, I urge you to read Dr. Slim's book, Humanitarianism 2.0. It's very reader-friendly. It's relevant for anybody who cares about what's happening in the world. So please read it. It comes out October 10th. My intention is to raise a question for discussion. Let me first preview the question, and I'll outline the context for it, and then I'll come back to it and expand on it. Here's the preview. So far as we can see, what kinds of climate-driven shocks and stresses are coming at us in the next 20 years, we need to work across all sectors to prepare for them. This work is not exclusively for humanitarian organizations to do. Other fields, because of their own missions and intrinsic ethical commitments, need to partner with humanitarian groups. And one of these fields is health systems. So I ask, what does Humanitarianism 2.0 mean specifically for health systems? Now, here's the context for my question, just to recap a few selected points from the book. The emergency that Dr. Slim talks about is as follows. Some uncertainty in forecasting may be unavoidable, but I'm quoting here, a clear trend is taking shape that confirms a global increase in people's experience of climate shocks and a significant percentage of people at high risk from them. This suggests that humanitarians can expect a very large and continuous surge in human suffering and impoverishment from climate change. Billions of us around the world will be exposed to some climate shocks, but humanitarian activities will need to focus on the hundreds of millions of people who will be most likely to experience the severest forms of suffering and impoverishment. We also want to try to prevent that from happening. We can foresee that it is likely to happen if we don't change the way we're doing things, and some of it may be unavoidable. And at the same time, we also have to pay attention to the human connection to nature. That Dr. Slim discusses throughout the book. We depend on global ecological flourishing for our most basic survival needs. As many indigenous cultures have always known and never forgotten, we really are all in this together, people and nature. And it's time for us all to start acting like it, especially those of us, people who look like me, for instance, who have grown up in cultures that historically neglected and disregarded that essential fact. Now, the response to the emergency is it has to be very proactive. Again, quoting from the book, the actions necessary to respond effectively to the emergency when it hits in the future can only be taken in advance, such as developing new technology, transforming organizations, still quoting here, training people, like many of the students here, researching threats, building capabilities, and stocking up on reserves. Now, end quotation, my comment here is, on the one hand, sure, we wish this was not happening. It would be really great if it was not happening at all. But as troubling as it is to contemplate, given that it is in fact happening, and we have to unfortunately accept that reality, there is much consolation to be found in doing the right thing, which I'm learning from reading Dr. Slim's book and other sources. The right thing to do, I believe, is to comprehend the emergency and to organize our best proactive efforts now to prevent the worst kinds of climate shocks or soften them somehow, to build up protections for people in nature against them when they do happen, and prepare to alleviate whatever suffering and distress may be impossible to avoid. You can hear how forward-looking this all is: proactive, prevent, protect, prepare. Not because I tried to make it come out like that, it's just what it makes sense to say. Visualize the future scale and intensity of these impacts on health systems and ask yourself, what should we do now to prepare? So I come back to my main question: what does Humanitarianism 2.0 mean specifically for health systems? One of the intrinsic ethical commitments of health systems is to take special care to serve marginalized or disadvantaged groups. which includes the people most exposed to climate-driven risks. And it also includes, I think, natural systems that have been kind of pushed to the brink of survival by human activities. Now, the health systems community is already thinking about this to some extent. For instance, this year, the WHO published a report on a set of indicators to measure and monitor health system resilience, meaning the ability to effectively anticipate, prevent, prepare for, adapt to, recover from various shocks and stressors, including war and conflict, including climate-driven severe weather, and other catastrophes. But I think for the case of the Earth emergency that we're talking about, it's critical for health systems to anticipate more fully the scale and intensity of these future shocks and stressors. Secondly, it's important to think more about how health systems are situated, not just in populations, but also in landscapes, natural landscapes, where our relationships with nature have intrinsic ethical importance, and they also pervasively affect our ability to breathe, to drink clean water, to eat good food, and to sustain our mental health and practice our livelihoods. So just a few more specific questions to help get the discussion going, and you probably will think of better ones. But I really would like to take this to a level where folks who are studying to become public health practitioners and health systems think about, what do we need to do now to get ready? How will things like healthcare financing need to change? How will maternal and newborn healthcare need to change? How will injury prevention and rehabilitation need to change? Those are some of the areas we work in. So thanks for listening, and over to you, Gabby.
Thank you so much, Dr. Harris. So it's been an absolute privilege to be here today, and it was an absolute honor to be able to have an early read of your book, Dr. Slim, so thank you. But reading the book and listening today, I've had three thoughts come to mind. Climate change is a challenge for our generation, and for the next. Not only will it bring with it new, unanticipated challenges and emergencies, but it's also an effect multiplier that will exacerbate society's ills and the vulnerabilities individuals, communities, and our surroundings experience, as you've described. I'm an accident and emergency doctor by training, and I like to think about things through that lens. The various places I've worked, the humans I've interacted with, and a human interaction with the world around them, and the subsequent impact on health is evident in the diseases I've treated. So the framing of the need to consider the natural environment and the symbiosis of humans within it is core to our understanding and protections of humans was not a hard sell. And I think it's important both for humanitarians and beyond. When thinking about climate change, for me, and its impact, the following comes to mind. I see us calling patients from a waiting room. The waiting room keeps filling, and no matter how hard you try to help and support those that attend, it keeps filling and filling. We're at a stage where soon we'll run out of chairs, the need will increase, new problems will arise, and those we have tried to support and help will simply return. Unless we try and take a more complete and holistic approach, as you've described, the asthmatic child living next to the motorway returns, and the waiting room gets bigger and bigger and busier. I've been convinced the only way to truly address needs today is to take into account of the bigger picture and the larger organism of which humans are a part of, nature and the earth. But it brings me to the following. I was introduced to precautionary ethics while reading the book. This for me really brought to the forefront questions around collective responsibility for proactive response and how that might impact and change the timelines in which we work. Time to me seems to be a really important factor for climate change in such a slow motion emergency. Responding to and building a response will not just need to address immediate needs, but also anticipated needs, which will change and develop as new problems emerge, and which may not be entirely predictable, for example, new emerging diseases. I think this changes and shifts the endeavour from sole focus on the immediate need to include a medium and long-term focus. We tend to think short-term, and it's easier to do so often. So how do we reconcile the short and long-term thinking, the reaction versus proaction, the intervention versus prevention? And I know this is happening already, but how do we improve it? In the book, there's an example of mangrove replanting to protect coastal communities in the medium term. How do we decide to divert immediate help to longer-term measures to reduce vulnerability? And when is the correct time to do this? How do we encourage decision makers to think beyond the immediate to get a grip on the uncertainty of the future, while they also have to work to address immense immediate problems? What structures do we need in place to support this, and what might this new system look like? Furthermore, it made me contemplate how we anticipate and predict, what goes into these models, and how this impacts how and what we predict, and how and what we measure, and who is or who should be listening to respond. I came to consider how we make decisions in the now faced with these newly defined principles. For example, greening and climate-proofing responses. By greening, I mean improving the environmental footprint, and climate-proofing, adapting to future needs expected in a changing climate. Taking simple measures, for example, electrifying your fleet of vehicles, how do you begin to weigh up the cost and impact of such a greening decision against future benefits from having done so, particularly when the cost to societies and communities is perhaps not entirely known? For example, to those mining the cobalt needed to create such technology. How do you make the decision to invest in these changes now amidst massive other need? Finally, I worry about how we meet such immense future needs. But sitting here today, surrounded by such impressive thinkers and doers, I feel confident that we'll get there.
Good. So I think you can start on your second book now, or your fifth to this. You've got a lot of things to think about. I think what we'll do is we'll give it open up to you to perhaps give some thoughts and responses, and then we'll open it up either to people online or in the room. So thank you, and thank you very much, Mariah and Gabby.
Brilliant, Mariah and Gabby, thank you very much. And thank you first for taking the time to reading the book, because I know it's a bit of a pain to read a book these days. But thank you very much, and I appreciate it. And I think what's interesting listening to both of you is that, well, first you've been very polite about it, so thank you for that. You know, some audiences won't be, I suppose. But I think what comes across really is the point that Maria made really about the pro and the pre, the prevention, the preparedness. And you know, in every aspect of life, we're always being urged to prevent, but at some point we're going to get there, I think. And actually, as humans really realize that that's where we need to be. And I think, in a sense, this demands a change so that we're thinking more from the future than we are thinking, you know, from the past about what's going to happen in the present. And I think that will inevitably happen in the climate emergency because of what people are saying are going to be unprecedented events. You know, when things cascade, things will happen that, as you said, that we won't have predicted. There will be these multiplier effects. So in a sense, we're not going to be able to plan that much from the last 100, 2,000 years and think forwards from the past. We're going to have to think much more about what's likely to happen and work on that. So I'm hoping that, you know, humans will make that epistemological gear change as they're hit more and more by things that they, you know, don't typically recognize and weren't expecting. So I hope that prevention and preparedness does come. Gabby, I'm really glad that it was not a hard sell, and that actually, and it's very encouraging to hear that makes sense to a doctor and a medic, that nature is integral to our health. Because in a way, it's probably not always felt and understood by most in the population, where nature is not really given personality anymore in many sort of urban lives and things. So I think part of this challenge is to sort of rediscover nature, and that's great that it's not a hard sell. And it's also really important to hear that therefore you can think in Earth terms about health and your waiting room being filled because of Earth's challenges rather than individual human challenges. And I think that's really encouraging too. So both that, you know, that emphasis on the future and trying to work from the future more, as Maria is saying, and then Gabby's point about, you know, let's recognize nature as so important in health, tends me to think, as I was saying, that I think it will be your community, and not for the first time, that actually pulls the humanitarian sector towards more holistic thinking and more holistic working. I hope so.
Thank you very much. Let's open it up firstly here. Is there another
Ceiling mics.
Oh, so okay, great. Ceiling mics. So anyone would like to maybe we'll take 2 questions to start off with. Sarah, please.
Thank you very much, Hugo, and the panel. It was certainly a provocative and really interesting discussion. I guess I'd wanted to focus in more on the third part of your argument, Hugo, about the implications for organizations and institutions. And perhaps to draw a distinction between what I think might be conceptually appropriate and what might be practically and strategically appropriate. And it reminds me a little of the sort of debate about the Millennium Development Goals versus the Sustainable Development Goals. I think, in my view, the Sustainable Development Goals are much more conceptually appropriate. They see the linkages between different sectors, between human health, animal health, urbanization, and all the rest of it. And yet, as a consequence, I think they have become remarkably complex, very difficult to interpret, and really difficult to act upon. And I wondered if you saw some risks here in terms of the argument that you're promoting. I mean, I think if humanitarianism was the only game in town, the only way in which we were pursuing development, and then certainly, focusing humanitarian effort on an approach which more clearly recognizes the integration between human health, animal health, and environmental health would make sense. But I wonder if you see a potential risk that by arguing for this greater integration in sort of a One Health approach, what might actually happen is that we lose our focus upon the most vulnerable populations, and to recognize that there's obviously other scientists and other advocates who are clearly making the case for thinking more carefully about protecting the environment that we all live in and depend upon. And then just a small sort of add-on question to that, which is, I sometimes wonder whether, of the 3 I's, if we had the intergenerational one embedded into humanitarianism, whether that might, in practical terms, address many of the concerns you have at this point.
That's great. That's really helpful. Thank you, Sarah. I didn't realize there were so many Brits in Baltimore. It's quite funny. Good. So I totally agree with that. And I think there is this huge, as you say, strategic, tactical risk of, the truth can be too complicated in a sense sometimes. So you've got to take bits of the truth and simplify your objectives. And so I think that's right. But if I try and think of, as I might take MSF, for example. First of all, I would agree with you that humanitarians must keep their focus with the most vulnerable. I mean, that's not going to change in changing the principle of impartiality. It will be where there is the most urgent case of distress, and often where other people aren't as well, other institutions aren't. Because I agree with you, there are other institutions, and Maria said the same thing, but very often humanitarians find themselves quite lonely in these very extreme environments. So yes, they must keep that basic commitment. I should emphasize that more. But if you look at MSF, then it makes sense that if MSF really, Doctors Without Borders, if they want to really work without borders, they have to work beyond human borders as well, beyond the border of the human. And I think that means in an environment, they would just quite simply follow this kind of thinking and be more logical and say, right, where are the sort of earth dimensions of health in this scene? And it's going to be about water, it's going to be about food, it's going to be about drought and weather, it's going to be about zoonotic disease and veterinary engagement and these kind of things. So we can work with a landscape approach in that way. So I think it's probably NGOs will get this more quickly as usual than the big institutions that are so rigid in their mandates and identities and vested interests. But I don't know if that answers your questions, but I take your point about overcomplicating the challenge, and particularly when there's so many other challenges. But I think when you explain it in MSF terms, it becomes quite simple, actually, and that's what we have to do.
Please introduce yourself.
Hi, Dr. Slim. My name is Jason Rush. I'm a MPH student here. And so I've been trying to kind of think about the cleanest way to formulate this question, but essentially, I agree with the premise you talked about of changing the way we view things as opposed to it being humanity as separate from or above nature of we all need to work collaboratively, whether it be across human societies or just different life forms. But I guess this is going to sound jaded, but thinking about organizations like humanitarian organizations like the United Nations, that technically no one has to do what they say. So even if the UN changes their paradigm on this and follows this policy, productively, how does that change anything if you have a country like the United States that is large enough and wealthy enough and has a strong enough military that it can kind of just say, we're going to do whatever we want? And how much of a focus should there be on changing the paradigm in these large scale international organizations versus focusing on a bottom up approach of getting people in these countries to accept that we need to make these changes? Like, I think from an American perspective, again, if the government decided we want to kind of change the way we look at these issues and take into account the needs of nature versus just what do people need, if the general public doesn't like that, like no politician is going to push for it because they will be voted out if you are the person that says, you know, everyone in the city wants this bridge to be built, or we want this project to be done, but this isn't good for nature, and you say we can't do it, people will just vote you out. And especially in our country, kind of the entire history of it is kind of us doing things against nature, combating nature, kind of forcing nature to bend to our will. It's just not a natural part of the way we culturally see ourselves and our relationship with the world. So it feels more like it needs to be a fundamental shift in kind of the way people see their interactions with the world around them. And I guess what role do international organizations like the UN or anyone else have in, should they be focusing on addressing that or just changing their own policies and saying, this is what we think should be done, do it if you want to? It's kind of like a very big question that I don't necessarily expect you to have an answer to, but if you have thoughts on it.
Jason, thanks. I think it's a really good point. It's a really good point in two ways. First of all, the fact that very often you get these big institutions that espouse certain ethical objectives and purpose and don't really do them. You know, so there is this hypocrisy that's intrinsic in a lot of institutions and individuals where, you know, we're all the same, I think. But your other point is very important about politics. You know, what actually, where are the incentives to take this seriously? And all I can say is that, you know, that's up to people to change. And I do have a feeling that as people experience more and more floods and heat waves and other things, they will realize they need nature. In a sense, that this will really change. They need nature to be itself in certain ways around them. And they will probably be starting to ask for more nature in some ways. If people can make the connection that it's going to be, you know, trees and shaded areas and better management of water and all sorts of things that are going to keep you cool, then I think they will see their need for nature and nature will have resonance. But of course, that's not the same as nature's needs. And that's where you're rightly pointing out to the risk of sort of green colonialism, as they sometimes call it, where you sort of prioritize other life over human life and that sort of thing. And there's going to have to be some tough struggles. And that's why I think it's important to have nature represented at the table, so you can have a jolly good argument with it as well as anything else, in a proper, you know, deliberative democracy way. You can't argue with someone who's not at the table. You know? So I think you're right. It's the big challenge for your society, for American society, for other societies. And you know, I can't, as you say, I can't give you a quick answer to it, but I think it'll be somewhere in all that. Mariah. Yeah, sorry, Mariah. Yeah.
Thanks for the question, Jason. So I wanted to let you know about an organization that I support and volunteer for called the Environmental Voter Project, which is nonpartisan, and it has identified 4.8 million voters, registered voters in the United States, who rank climate change and the environment as their top priority, but do not vote. So the goal of the organization is simply to encourage the behavior of voting, because once politicians see who's voting, what they care about, then they will care more about those issues. And I won't take more time about it now, but I think people in the room here might like to explore the Environmental Voter Project and check it out.
I think just on another point, because I remember it brought to mind a paper I'd read, so in Ecuador, where they do have the rights of nature in the constitution, in fact, nature doesn't always win at all, because, you know, human rights are there as well. And so I think, you know, it's not a given that green colonialists will always win if you take this approach.
Please, please.
Thank you all so much. My name's Logan Fenhouse, and I'm also an MPH student here. Dr. Slim, you were talking about that we really need to change organizations to have more of an integrated approach rather than like a really siloed approach to handling any crises. How do you see the cluster approach? Do you see that as like an attempt to integrate it more? And how can we use that existing framework of that cluster approach to kind of build on that to involve more organizations more fully?
Logan, thanks very much. This is always very awkward because, I mean, the reason I don't write books about the cluster approach is because I never really understand these things. I'm not very good operationally and practically. So I always end up writing about ethics, where you can sort of have big ideas that other people have to worry about doing something about. But the cluster approach has been great at one level because it really has tried to bring together people around particular things, whether it's water or protection or food security or whatever. I don't know exactly. I think you probably, it might give you an opportunity to break some of those clusters and to think in bigger category terms, more like the Millennium Development Goals in a sense than that, because those are sort of technical sectors as well. And maybe you could think, about heat or health, or I don't know how you would do it, but I'm not thinking well about it. But I think you could recluster in a way that made simpler and better sense around synergies between nature and humans in some way. But I can't see it yet. That you'll have to come up with that. Miss Maria or Gabby.
A response and then maybe a question related to you. So, I mean, one of the issues of the cluster approach is that there's still the intersectoral coordination is so difficult and it fails constantly. And we have to somehow, there have to be silos in some ways. We want to try to break them down, but they need to be categorized. There needs to be a framework. And I would say the other big problem with the cluster approach, and it's something I'd love, maybe the two questions I would have for you. One is it's consensual based. And so if we have enough, what happens is consensual base often means that it gets very much watered down. And there is a lack of accountability. And so that's maybe one question for you, but I also have another definitional question. Is humanitarianism for me and for most of us in the humanitarian world is something very specific, which is more an emergency focused. And in some ways, but human or the way you can look at humanitarianism can be much broader. And I'm wondering what your definition of that. And just before we were talking about this, the humanitarian development nexus, and we can't just think of humanitarianism and the environment, or let's say humanitarian emergencies in the environment. We also have to think about development and all these other areas. So I'm curious to understand your definition of humanitarianism, and is it the more tightly humanitarian emergency focused, Red Cross, Red Crescent, or is it broader?
Thanks, Paul. So I'm a bit slippery on that because if you look at the principle of humanity and impartiality, they work on the word relief and alleviate. So they work on the idea that, a humanitarian response is, or an emergency response is one that sort of lifts people up again onto their feet or lifts things off their back that are weighing them down, it alleviates and relieves. And so my view is that if that is your goal, and it needn't necessarily be this urgent, immediate, tomorrow, very life-saving thing. It can be the mangroves that Gabby talked about, because if you're a community living on the coastal area and your storms keep coming and they keep destroying your houses, then one way to relieve that problem is to engage nature on your coastline to create new structures of mangroves and others, which then create new biodiversity around, which gives you livelihoods as well. And it relieves that pressure of the storm off you. So, I mean, the example you gave from the book is a 30-year project by the Vietnamese Red Cross. That's relief to me, if you like. And it's particularly relief, going back to Sarah's point, if nobody else is there doing development or something, then the humanitarians can talk about that as alleviating suffering, even if it's a long-term investment. That's my way to sort of shape it. It is still life-saving, and it's impoverishment saving and that sort of thing. I mean, I think we struggle with this in the humanitarian field because of medicine, in a way, because, the medical tradition in humanitarian aid gives us this incredible precision of saving a life. That is a very much sort of bodily encounter definition around breathing and biology and blood, but, you can think about it in slightly longer terms as well, and a lot of communities do, who don't have development people all around them.
I think that may be one pushback from the humanitarian field, is that we're still
because development is often failing or there's not enough money, the humanitarians are being asked to respond longer for longer and longer and really do the jobs of governments that government should be doing if they were functioning. So yeah, just thinking that through in terms of humanitarianism 2.0, and what you're talking about, I think also is either from a temporal point of view, longer than just humanitarianism, but really encompassing decades or even generations, I think, of work. So it could be the humanitarians need to think about how their definition of what humanitarianism is. Questions, comments? No, I've been looking. Online, anyone? You're being shy?
Looks like there's lots in the Q&A, but
Oh, there's 10 things in the Q&A.
Paul has access to it.
Okay.
I see two, right? That's me. Oh, 10 though. I'm not seeing. That's interesting. Akiba, are you able? I can't see them for some reason.
I'll work.
Yeah, I can only see.
Only if they're easy questions, don't bring.
Questions could also be answered after the webinar.
But yeah, I apologize everyone because I did not, they're not coming up. Maybe because I'm not, I apologize. Okay.
You're not on a Mac.
It's sorry about that. I would have asked these a long time ago. Give me 1 second, please. Yeah, so one aspect I think from one colleague relates a little bit about what we were talking about in terms of the choices people have to make, the prioritization and the funding that could or could not be related to this. And, you know, you mentioned, which I wasn't aware of, that the Germans just cut 50%. It's across the board. Most UN agencies now are cutting by 10%. So one is that. Give me a second, please. So the next question relates a little bit, I think, to what you were mentioning about the sphere guidance. And for those of you that are aware, sphere guidance are the humanitarian standards and charter, but sphere unpack guidance on nature-based solutions in humanitarian action without an environmental cluster. So someone is mentioning the idea. So we have an early recovery cluster in humanitarian, but we don't have an environmental cluster. And that could be interesting in terms of collective responsibility. And why don't we start with that, and I'll read the others too as we move forward, and then Gabby and Mariah, feel free after Hugo.
Brilliant, thank you. So I can't see names in the Q&A, but thank you. On budgeting and prioritization, I really understand that. I can hear people saying, why are we going to be planting trees or, looking after river systems when people are dying? We've only got so much money to stop people dying, etc. But I do think, at one level, and particularly this will be true if we get massive needs in the climate emergency, and we really get the billions that, rather than the tens or hundreds of millions, that it shouldn't be a zero-sum game. And there'll be some times when humanitarians have to make those hard decisions and say, look, for the benefit of the human community and the nature community in this landscape, we're going to have to really focus on keeping that ecosystem alive, or something like that, or that water source alive, or something, or we're going to have to really focus on adapting the crops in this area. And I think in certain places you will get those sort of decisions where you are probably prioritizing nature first to get the biggest advantage for everybody in the landscape somehow. But I'm not sure. I can see how it's tough, but I think it comes back that if you really ask most humanitarians how they're saving lives, and you introduce nature as a concept in humanitarian aid, they'll say, yeah, we are using a lot of nature to save lives. And we're working a lot with nature to save lives, to try and increase harvests or find more water or whatever. So it's not a zero-sum game to me very often. And on the environmental cluster, yeah, I didn't know there was an environment cluster. But again, I'm slightly wary of boxing the environment issue and the nature issue, which is, let's have another cluster and then somebody else can be in charge of it who's got an environment mandate or whatever. I think the whole challenge here is to see these things as much more seamless. And, you can't have any cluster that's not discussing nature in some way. It doesn't make any sense, and not taking account of nature in some way. But I think.
Well, I just wanted to give a shout out to the Institute for Planetary Health at Johns Hopkins, which was recently founded, and I encourage everybody to explore what they're doing there. In my brief period of getting to know the concept of planetary health and the practice of it, I found it really encouraging, because once you start to read what people are actually doing to simultaneously address biodiversity, climate change, land use, air and water quality in specific settings, you suddenly develop a much more expansive sense of what's possible. And I think that ought to influence us when we tend to start thinking about trade-offs in a very abstract way. What I've learned is I just pause and I think, is that really a trade-off? It's an apparent trade-off, but let's see whether it's a real one. Let's see what people are actually doing. And oftentimes I find that the apparent trade-off dissolves. So we have lots of colleagues at the Planetary Health Institute who are working on that very thing.
I suppose expanding on that, maybe asking another question from that, which is, from what you've discussed and from what we've been discussing here, I think, humanitarians don't act siloed. They work with other organisations and situate, work with governments and with development organisations. And so I suppose, how do you feel that this then links with the work that they're doing? How do you encourage other people to come with you and to take this, I guess, nature-based approach, or to sit nature, in that position? And do you have any thoughts on maybe kind of extending this beyond just the humanitarian sector?
I'll add a couple more just because of time. So another question was, you focus a lot on the environment, but less, let's say, on the one of the animal component. I think I know the answer to that, but maybe just respond to that. And then another colleague, or Robinson, asked about this issue of responding to save lives immediately. For example, in the Indian Ocean tsunami, a number of plastic water bottles, for example, that were brought in. So these may be short-term, that are going to be against sustaining or the anti-environmental, but may have an immediate effect. And then finally, related to that, and a bit to what Josh's question about governments, is also going to be corporations, private sector. How will they may have, particularly for short-term profit, may have very different goals, and they're very influential.
Thank you all very much for these questions. Gabby, on your point about bringing other people with you, I think that's right. I mean, I always tend to write for the humanitarian profession, so limit myself, I suppose. But somebody said you could call this development 2.0. I mean, you could just say this is bigger than the humanitarian field, and it's a bigger challenge we ought to address. And maybe that's right. I don't know. On animals, I think, in a way, the humanitarian profession has recognized the significance of animal life for a long time, actually, because cattle vaccination programs, livelihoods, in the sort of possibly instrumentalist way that they understand that cattle and sheep and other things to eat and to sell and to accumulate value in are important to people. So I think humanitarians get animals more quickly. If there's a sort of vegan implication in that question, I didn't see the question. Yeah, but there is a possible challenge there if you're saying you're an all-life humanitarian, but you're still eating beef, but you're not eating humans. So you're making a distinction, you're discriminating on one level around life itself here. That's a really valid question, and I attempt to answer it in the book and didn't get far, but I'm still eating meat every now and again. So I see somehow in my understanding of nature and the earth and the context of all life that there is a sort of killing and eating symbiosis as well, in which we live hybrid lives together. So I haven't answered that well, but I think humanitarians must prioritize animal life because of mutual aid. We need to show humanity to them because they show humanity to us by, we live from them and with them. On plastic and things, I think that's absolutely right. There are these terrible trade-offs, and there's also the trade-off that you use airplanes to drop food in some situations and say massively hype up the emissions of a humanitarian project. But these are going to have to be dealt over time as part of mitigation strategies, and people need to be working all the time, like you was saying, to reduce their reliance on climate-damaging carbon-based products. And that's going to be a long-term trend. But I'm sort of optimistic, actually, in a strange way. I think a lot of people suffer terribly in this Earth emergency over the next few decades. But I do have a sense that we will find ways to adapt to changing climates, that we will find business transitions that shift us in beyond the carbon economy to use new materials, new energy sources, new textiles. I think we really will. And then the problem is the irreversible damage that's been done already, that we're going to have to try and survive and live within that context. But I'm certainly not apocalyptic about this. I think a lot of people will suffer and die and become poorer. But I think we will eventually find a new way of being human in the earth and on the earth that works.
Corporate greed.
Corporations. I don't tend to sort of damn corporations in a single category, actually. I think a lot of the things that take us beyond the carbon economy will have been invented, innovated, and rolled out by corporations. So I think eventually, and business as well tends to alleviate poverty more than the welfare work that most humanitarian organizations do. You can create wealth, create jobs, create other things. So corporate greed in nature has always been a problem. Capitalism has been really brutal with nature. And I think that's going to be a community that has to learn as well to be nature positive.
Thank you. We're going to have one last question. Did you think about the term Earthitarian, or as opposed to humanitarian? But really the next question is, I mean, what you firstly, thank you. What you've done, I think, is provoked us to think broader. The hard part will be how to try to make it feasible, operationalize it, taking into account from the politics to the economics to power. And that's one reason, Jason, why I do think the UN, with all of its flaws, is important, because some of these broad treaties may be able to push certain governments, but by no means a utopia. But what next for you in terms of these ideas and advocating for them?
Just on that point of, things will change and we can make these changes, and the UN is a good place to do it. Just a little reminder that, of course, we in each generation inherit ethical ideas that we assume to be somehow fixed, but they were usually evolved and invented. And it's always surprising to some people that the principle of humanity was not a Red Cross principle before 1965. It just seems so central to us now. But it wasn't actually. There were 4 principles and 12 other principles, and it was all impartiality and independence and neutrality. Sort of humanity was sort of assumed, but it didn't feel the need to state it. So we weren't even prioritizing that. So I think these things will change. What's next for me, I'm not sure. I'm thinking I might try and do a bit more diplomacy again. So do humanitarian diplomacy. So I'm not sure I want to write a 3rd book in a row quite yet. And I tend to, in my career, zigzag between, as you said, agencies and academia. So I might do a final zigzag into agencies for one last time, and try and do 5 years or something doing diplomacy, perhaps around this, or with new humanitarian ideas and things like I used to with the Red Cross.
Great. Well, thank you, Hugo. Thank you, Mariah. Thank you, Gabby, very much. Thanks for all of you online and in person. And we will we'll share, at least it comes out October 10th. So
yeah, I'll send some copies here because these guys really deserve it. I mean, if only just to put their coffee cup on and think, damn it, I had to read.
So we'll also share that out with you and everyone. Thank you very much, and thanks everyone for coming.
Thanks, everyone. Oh, lovely, yeah. Doing this. Pushback. I got about 3 more to add.